Meanwhile, the pandemic was a large part of the governor's State of the State address last night. If you watched part of it, you heard that in all likelihood. CBS 11 political reporter Jack Fink now ready to get some of your questions answered with the governor. Jack?
Well, Doug, thank you. And Governor Abbott is joining us live from Austin. And Governor, thank you for your time this afternoon. With regard to the COVID vaccines, we've seen people wait for hours in lines, travel hours across the state, and have difficulty registering for the vaccine. What is being done to make it easier for Texans?
Well, listen, Jack, the most important thing that can be done is what we're working on, and that is getting more vaccines from the federal government. People need to know that Texas does not have the vaccine supply. That's the federal government. Today, the governors had their weekly telephone conference with the president's COVID-19 vaccination program, and we learned that we actually will be receiving more vaccines in the coming weeks, beginning this next week. And so the most important thing that could happen is happening, and that is we will be getting more vaccines, and then we are to anticipate that increase to continue with the Johnson & Johnson vaccine likely being approved in the next 10 days or so, and maybe AstraZeneca by the end of this month. Bottom line, though, is we will be getting volume to the local regions. In addition to that, we've seen varying different results in local regions based upon the strategies used in those regions to get people registered. Many regions across the state of Texas use a system that has people sign up in advance before they show up, and wherever those systems are utilized, they prove to be extremely effective at getting people through there. I was there near your area in Arlington, Texas, where we saw that system work very effectively. We've seen it work in Arlington, in Amarillo, and other parts of the state of Texas. But the key thing, though, Jack, is just getting more vaccines, which hopefully they will be coming here in the next week.
And Governor, did the president's team tell you today, give you an exact number? Because I know that's one thing that happens from week to week.
So you are right. So they've made two modifications. We were getting weekly allocations, and we kind of wouldn't know exactly how much we were getting until maybe a day before. Now they're giving us 3 weeks advance notice about how much we are getting, and they said that there are two ways that we could or should expect increases for the next 3 weeks. One is an across-the-board 10% increase. Another is an increase in the number of vaccines that can be coming from the Pfizer vial. And then there will be additional allocations made to drugstores. That has already been, I've seen stories about that already today, where the Biden administration released that to the public, where 1 million additional vaccines across the country are being provided directly to drugstore chains, of which Texas is going to get its per capita share.
Are the increasing number of hubs that we are seeing, for example, the one at Texas Motor Speedway today, meant to centralize the process more?
Yes, and let me explain why these are used. When you access the Pfizer and Moderna vaccines, because of the ultra-cold temperature they must be kept at, you can only leave them open for so long and they'll go bad. And hence we need to use locations where we can get a lot of people in those locations, where we can administer a lot of vaccines. Also, the most important thing during a pandemic is to vaccinate as many people as possible, as rapidly as possible. And that's one thing that is achieved by these mass vaccination sites.
I know you're still heavy in 1A and 1B, but a lot of people want to know when the next eligible group will be able to get the vaccine, and also why isn't a second dose guaranteed in the state?
Well, first, I can tell you that the second dose is guaranteed in the state. Our plan all along and remains that everyone will be getting a second dose. And so I'm unsure of why you're saying that it's not guaranteed, but I can assure you a second dose is guaranteed. But let me answer the first question, and that is we will expand beyond 1B. once the vaccines are available to provide to more than just 1B. We're working through it very quickly. Texas ranks number 2 in the nation for the most vaccinations that have been administered. And so we have the capability of providing the vaccines once we get them. When we have the expansion of the vaccines that the Biden administration is providing us, plus the addition of Johnson & Johnson, which, by the way, Jack, is only a one-shot dose and doesn't require the same temperature controls that Pfizer and Moderna require, I think that will really accelerate the process.
Wanted to ask you about public education. How concerned are you that students not back in school, students who have been absent, are really falling behind, and what is the state doing about that?
So we're very concerned about the status of our students. We know that they're falling behind, and that's exactly why we want them back into the classrooms as quickly as possible. The best setting for a student is in a classroom setting with their teacher. We know students learn far better that way, and it's also better for their mental health situation. And so we're urging to get students back in school as quickly as possible, knowing this also, Jack, and that is schools have proven in Texas as well as around the country to be a location where there is unlikely to be very much spread at all of COVID-19. Spread is far more likely to take place at after-school events or in the home setting or in other private settings like that, as opposed to a school setting. And so we're working to advance as quickly as possible to get kids back in school.
Governor, Democratic and Republican state lawmakers have told me they would like to see the legislature to be called in any future emergency. God forbid we have a second pandemic. Is that something that you could support?
Listen, we are coming up with a package for pandemic relief going forward to make sure that we as Texans will be able to both navigate a pandemic while also keeping businesses open. But remember this also, and that is there's an absolute need for speed whenever you're dealing with any type of emergency, whether it be a pandemic or a hurricane type situation. And we need to make sometimes decisions within minutes, hours, or 24 hours. Think of the ability to move on a moment's notice with regard to removing certain regulations that are necessary to be removed, sometimes to save lives. The imperative to quickly disperse PPE to certain locations or to acquire PPE from other locations. And so a lot of what happened during the course of a pandemic, you don't have the time to have a bill offered up by a member of the legislature, work its way through a committee, and then go through hearings, and then go through vote cast both in committee and then on the House floor and the Senate floor, and have that match up with both the House and Senate, and then approved by the governor. That's something that actually takes months in time to decide, during the course of which a moment's notice is required to make dozens, if not hundreds, of decisions.
Governor Greg Abbott, thank you so much for your time today. Nice to be with you. Thank you so much.
Thank you, Jack. Take care.
You the same. Doug?
Jack Fink, Governor Abbott, thank you both. Good conversation and some good answers for a lot of people who had questions, and we'll keep getting them. Jack, thank you.